The next question, member for London West.
Thank you, Speaker. My question is to the Premier. Speaker, Londoners are doing their part to limit the spread of COVID-19. They're following public health guidelines. They're lining up for hours to get tests for themselves or their children. But now the government is capping how many tests can be done in London. A leaked government memo states bluntly, "Do not proceed with any new growth or expansion of assessment centres at this time." Speaker, just 2 days ago, our local medical officer of health warned, and I quote, "We've had so many people that have been turned away or not even seeking testing because of the long lineups, and that means that there are certainly many times more cases in the community than we're able to diagnose right now," unquote. Speaker, why is this government capping testing in London instead of allowing assessment capacity to expand?
Minister of Health.
Thank you, Speaker, and I thank the member opposite for the question. First of all, there is no one that needs a test that is going to be turned away. There is no capping, there is no quotas. Anyone who needs a test is going to be given a test. But there has been a lot of information, misinformation I would say, about this, and I welcome the opportunity to provide some clarity. Speaker, with your indulgence, I would like to quote from the actual memo that went out from Ontario Health yesterday. In my supplementary, I'd like to provide further information about it. This is what it says, and I quote, "Anyone who needs to be tested per the guidance should get tested. There are no caps or quotas on testing consistent with the new guidance." Goes on to say, to that end, we are working with assessment centres on testing targets that are based on the historical utilization of tests in each region. A testing target refers to how many tests a region should need based on what we've historically observed in each region. They also help us determine the number of tests coming to us and from where. Additionally, these tests go beyond anticipated need based on the ministry's new testing.
Thank you very much. The supplementary question.
Thank you, Speaker. The memo also states, "Do not proceed with any new growth or expansion of assessment centres at this time." Speaker, this minister gave exactly the same answer to the people of Ottawa when my colleague raised this issue in this chamber yesterday. The government can pretend that its COVID response is fine, but its failure to plan for a second wave means that tests are being capped in both southwestern Ontario and eastern Ontario. The Premier knew that his government had struggled to complete even 20,000 tests a day in the spring. He knew that demands for testing would increase in the fall as students returned to school and post-secondary education. He knew that a testing backlog has been growing, leaving people who do get a test waiting days for their result. Speaker, why does this government think it's acceptable to cut off the line and cap the number of COVID tests available to the people who need them?
Stop the clock. Stop the clock. Neither the member for Ottawa South, nor the Minister of Municipal Affairs and Housing, nor the Minister of Natural Resources and Forestry have the floor. All of you have to come to order. Start the clock. The response, Minister of Health.
Thank you, Speaker. Just to complete what the guidance note from Ontario Health said is, Ontario Health will continue to monitor testing volumes daily and adjust as needed in order to align with and support the ministry's guidance. So the answer is the same because the strategy is the same. We have anticipated the need to increase testing, which we've done. We're up over 40,000 tests per day. We're increasing our lab capacity, and we're increasing our contact management. We're putting $1 billion into managing this. And so what I need to say to the member and to the people of Ontario is the reason why this memo was sent out is so that we can continue to support and increase the guidance and testing as necessary. This is a very complicated system when you have volumes coming in from specimens all across the province from very different regions with different labs doing the testing. In some cases with the revised guidance, somewhere the test volumes are going down, somewhere they're going up. So we're trying to match the guidance with the specimens going into the labs, bearing in mind there's a 3-day limit on the specimens. So what we're trying to do is to make sure we can continue to increase the testing.
Thank you very much.